Hi, my name is Mike. I'm an audiology doctoral student at the University of Minnesota. I have bothersome tinnitus and some hearing difficulties. I have cystic fibrosis, for which I've taken plenty of antibiotics, including tobramycin. I had colon cancer when I was 13, had 9 months of chemotherapy, which included fluorouracil and oxaliplatin, and I also have some history of noise exposure. The first time that I remember wondering if I had hearing loss, I was in high school physics class, and my teacher was playing sounds that only specific ages should be able to hear. So when she got to age 40 and the rest of the class was holding their ears and groaning, I couldn't hear that sound, and I wondered if maybe something was wrong with my hearing. I remember the exact moment I realized I had tinnitus. I was studying for an audiology exam. Ironically, it had tinnitus as some of the material on that exam, and I was using earplugs to study. And when I put the earplugs in, I heard this sound that got louder, and then when I took them out, it got softer. And I was wondering and realized that this sound that I've heard for my whole life, as long as I can remember, which I thought was me just having really sensitive ears, turned out to actually be tinnitus. Another time I was riding in the car with my fiance next to me. Her parents were in the front seats, the windows were down, the wind was blowing in, and the three of them were having a conversation, and I didn't pick up a single word, couldn't participate at all. The reason I'm telling you these things is because throughout my life, having the cystic fibrosis appointments and having colon cancer, I never had my hearing tested or even screened as a part of my health care. I was never educated regarding risks of hearing loss or tinnitus or ototoxicity, and so I can assume that some of my auditory issues stem from my history, but I can never be sure. But I know that I would have done more to protect my hearing if I knew that I was at high risk. Well, I'll leave you with some questions. How do we educate people with cystic fibrosis regarding the risk of hearing loss and the importance of protecting their hearing? CF patients, when they come into clinic, every time, their routine visits, they fill out a questionnaire about their overall health status. I've never seen a hearing-related question on those questionnaires. We should put some hearing-related questions on there. We should train CF clinic staff to learn about the risks of noise exposure, tinnitus, hearing loss, so they can educate their patients as they treat them. Perhaps every CF center should have a dedicated audiologist for yearly screenings or testing. And I think that all these things we could start doing would influence some change in clinical practice, which I think would be really important. I'm an example of a patient who slipped through the cracks, so to say. It took me until I was 24 years old studying audiology to find out that I was at higher risk of hearing loss. What can we do to change that?